A man kept his employer's health insurance after he turned 65. His HR department told him he didn't need Medicare yet. Then he had surgery. The bill came to $50,000. His insurance only paid $10,000. He had to pay the other $40,000 out of his own pocket, and that's not even counting the extra fee he now has to pay every single month for the rest of his life. That mistake took 15 minutes to make. It will cost him for decades. Here's how it happened and exactly how you can avoid the same thing. Here's a rule that almost no one tells you. The number of people who work at your company decides who pays your medical bills first. If your company has 20 or more employees, your work insurance pays first. Medicare pays second. That means you can wait to sign up for Medicare Part B while you're still working and you won't get a penalty. But if your company has fewer than 20 employees and you are old enough to have Medicare, then Medicare is supposed to pay first. If you haven't signed up for Part B, Medicare won't pay anything at all. Your work insurance, which was only meant to be the backup plan, will pay very little. That is exactly what happened to the man in the story. His company had 12 workers. HR didn't know the rule. He didn't know it either. Nobody caught the mistake until after his surgery. That $40,000 bill is now his to pay, and the problems don't stop there. Because this man didn't sign up for Part B when he was first supposed to, he now has a late sign-up fee. This fee never goes away. For every 12 months he was eligible but didn't sign up, he pays 10% more on top of the normal Part B monthly premium every month forever. In 2026, the normal Part B premium cost is $202.90 a month. He waited one full year, so now he pays an extra $20.29 every month for the rest of his life. And here's what most people miss. That extra charge doesn't stay the same. If the regular premium for Part B goes up in 2027, which it probably will, his penalty goes up too, because it's a percentage of whatever the new amount is. He will always pay more than people who signed up on time. If you're still working when you turn 65, your first question shouldn't be which Medicare plan to pick. It should be whether you're allowed to wait. Does your company have 20 or more employees? You can usually wait to sign up for Part B without a penalty, but don't just take someone's word for it. Get it in writing from your HR department. Do you have a health savings account? You need to stop putting money into it before you sign up for Medicare. If you apply for Part A and Medicare counts it as starting up to 6 months earlier, any HSA money you put in during that time could mean a tax penalty. Stop adding to your HSA before you apply and talk to a tax advisor about your timing. Are you on COBRA or a retiree health plan? Stop. This is important. Those plans do not count as active job-based coverage for Medicare purposes. That means they usually don't protect you from the Part B late fee. If you're past 65 on one of those plans without Part B, you could already be building up that same lifetime penalty. Let's look at the real numbers. Part B costs $202.90 a month for most people. If you earn more than about $109,000 a year on your own, or about $218,000 as a couple, you're going to pay extra charge on top of that $202.90 a month. It's called IRMAA. In other words, the more you earn, the more you pay. And here's the twist. It's based on your tax return from 2 years ago. So your 2026 premium is based on what you earned in 2024. Now, Part D covers prescription drugs. In 2026, there is a cap on how much you'll pay out of pocket. About $2,100 for the year. Once you hit that amount, your drugs are covered for the rest of the year. Once you're signed up for Medicare Parts A and B, you have to make a big choice, and it matters for years to come. Path 1, original Medicare plus a Medicare supplement plan. You pay a monthly fee for the supplement plan, usually between $80 and $200 or more per month, depending on your age, where you live, and which plan you choose. In return, you can see any doctor or specialist anywhere in the country who takes Medicare. No networks, no referrals, no pre-approvals needed. The most popular choices are Plan G, which covers almost everything after your Part B deductible, and Plan N, which costs a little less each month but asks you to pay small co-pays at each doctor visit, and also if you go to the emergency room and are not admitted. The next path is Medicare Advantage. These plans often cost little or nothing each month. Many of them include dental, vision, and hearing coverage that regular Medicare doesn't offer. But there is a trade-off. You have to use a network of doctors, you may need a referral to see a specialist, and the insurance company may need to approve a big procedure before they'll pay for them. For people who are generally healthy, this can be a good fit. But for people with serious or complicated health needs, these pre-approval rules can become a real problem. Here's the most important thing most people don't find out until it's too late. Switching from Medicare Advantage back to a Medigap plan is not always possible. In most states, if you try to switch after your first sign-up window, Medigap insurance companies can look at your health history and turn you down because of past health problems. This is only prevented if you qualify for a special rule in your state. The plan that costs nothing today could leave you stuck without the coverage you really need when you're sick. The man in the story isn't a rare case. We see people in similar situations almost every week, people who got the wrong information at the worst possible time. If you're turning 65 in the next 12 months, or you're already past 65 and not sure if you made the right choices, don't guess. The link in the description takes you to our 2026 Medicare checklist. It walks you through every decision before you make a costly mistake. We're independent brokers. We don't work for any insurance company. Our help is free to you. Click the link, download the checklist, or schedule a no-pressure call. We'll look at your doctors, your medications, and your income to help you find the right plan for your situation. Now, like and subscribe if you want the 2027 updates the moment they come out.